What if I told you that a machine, not a doctor, not a surgeon, not even a specialist with 20 years of experience, quietly looked at a medical scan one Tuesday morning and spotted something every single human eye had missed? And because of that one moment, a 34-year-old mother of two is still alive today. Now, multiply that by 10,000 people. 10,000 real lives, real families. And the question nobody wants to answer is whether we were ever really in charge to begin with. Stay with me, because this story goes places you don't expect. Before we go deeper into this, if you're new here, welcome. This channel, World Inventions X, is just getting started, and honestly, we're building something pretty special for people who want to understand the world that's coming. So if this kind of storytelling hits different for you, hit that subscribe button right now. It genuinely helps more than you know. Okay, let's get back into it. So let's go back to where this really begins. Not in some shiny Silicon Valley lab, not in a TED Talk. It started in a hospital in the UK, around 2018, in a radiology department that was, like most radiology departments, completely overwhelmed. Understaffed, overworked, radiologists reading hundreds of scans a day. And when you're that exhausted, when you've been staring at the same kind of image for 6, 7, 8 hours, you miss things. Not because you're bad at your job, because you're human. And being human, it turns out, has limits. The error rate in radiology, specifically for things like early-stage lung cancer, was sitting somewhere between 15 and 30%. That's not a small number. That's 1 in 4, sometimes 1 in 3 patients walking out of a hospital with a deadly disease still hiding in their chest, undetected, ticking. And that's where Google DeepMind walked in. Their AI system, called Streams at first, later evolving into what became part of a broader AI diagnostic program, was trained on something most doctors never get access to in one sitting: millions of annotated medical images, tens of thousands of CT scans, X-rays, pathology slides. It didn't learn medicine the way a doctor learns it, over years through textbooks and ward rounds and the slow, painful accumulation of experience. It learned it the way a machine learns, all at once, in patterns, at a scale that would be physically impossible for any one person or even any one hospital to match. And then they tested it. In a study published in Nature Medicine, one of the most respected medical journals on the planet, DeepMind's AI was put head-to-head against 6 expert radiologists, 6 of the best, and the results genuinely stunned people. The AI outperformed all 6. It reduced false negatives, that means missed cancers, by 11%, and false positives, those scary, unnecessary follow-ups that send patients into a spiral of anxiety, down by 5%. That's not a small improvement in medicine. That's a revolution wearing a white coat. But okay, here's where it gets complicated. And I want you to really sit with this part, because it's easy to hear those numbers and think, great, problem solved, let the robots take over. But the doctors who were working alongside this AI, some of them were uncomfortable. Not because they were threatened, not exactly, but because they genuinely didn't always understand why the AI was flagging something. It would highlight a tiny shadow in the corner of a scan, something so subtle the human eye just slid right past it. And the radiologist would look at it and think, that's nothing. And then the biopsy would come back, and it was something. That experience of being corrected by a machine you don't fully understand, that does something to a person. It forces this really uncomfortable question. Is this tool helping me, or is it replacing what I thought I was good at? And here's the thing that most headlines missed. The AI wasn't perfect either. There were cases, not many, but they existed, where the AI was wrong, where it flagged something that turned out to be scar tissue from an old infection, where the human doctor, drawing on years of sitting with actual patients, of understanding context, of knowing that this particular person had pneumonia twice in the last decade, caught what the algorithm couldn't. Which means what we were looking at wasn't a competition. It was a partnership, a really uncomfortable, really important, really necessary partnership. Now let me tell you about a hospital in the United States, a few years later, where things got even more extraordinary and honestly, a little eerie. The system in question here was built by a company called Viz AI, and what it was designed to do was detect strokes, specifically large vessel occlusion strokes, the kind that kills or permanently disables someone if they don't get treatment within about 6 hours. The problem with these strokes is that symptoms can be subtle. A drooping face, slight slurring, a hand that just feels off. In a busy ER at 2 in the morning with 17 other patients waiting, a doctor might see a patient who seems slightly off and order a CT scan, and then get called away before the results even come back. The Viz AI system sits in between. The moment that CT scan is processed, it analyzes it in real time. And if it detects a large vessel occlusion, it doesn't file a report, it doesn't wait in a queue, it sends an immediate alert directly to the on-call neurosurgeon's phone, right now, not in 20 minutes, now. In the hospitals that deployed the system, the time between a patient arriving and actually getting the intervention they needed dropped by more than an hour. In stroke medicine, they say time is brain. Every minute of a stroke, you lose approximately 1.9 million neurons. An hour of saved time isn't a scheduling improvement. It's the difference between someone walking out of that hospital or never walking again. Across the US hospitals using this system, thousands of patients got treatment fast enough to make a full recovery. Patients who, statistically, would not have made it in time without the AI's alert. 10,000 lives saved. Some estimates go higher now, and it's still growing. Here's your cliffhanger. And I mean this genuinely, because there's a dimension to this story that almost nobody is talking about in the mainstream. These AI systems are learning right now. Every scan they analyze, every outcome they're fed, every case that's added to their training data, they're getting better. Not slowly, rapidly. The version of this technology that exists today is already unrecognizable compared to what existed 5 years ago. In 5 years from now, some researchers, serious, credentialed, not the conspiracy theory kind of researchers, are saying that within a decade, AI diagnostic systems could potentially detect diseases like pancreatic cancer, ovarian cancer, and certain forms of dementia years before any human doctor could. We're talking about catching a disease while it's still stage 1, before symptoms, before the patient even feels sick. If that happens, and I want you to really think about this, the entire concept of a routine checkup changes. You don't go to the doctor because something feels wrong. You go because the AI noticed something in your blood work 3 years ago that you haven't felt yet, and it's been watching since. Is that incredible? Absolutely. Is that also just a little bit terrifying? I think, yeah, a little bit. Because here's what this whole story really is about. Underneath all the statistics and the case studies and the journal papers, it's about trust. It's about what happens when the thing that knows more than us isn't a teacher or a mentor or even another person. It's a model, a machine, something that was never afraid to die, never sat with a patient crying in the dark, never had a gut feeling it couldn't explain. And yet, it saves lives, real ones, not abstract, not theoretical. A mother who is still picking her kids up from school, a grandfather who made it to his granddaughter's wedding, a 40-year-old man who was told he was fine until the AI said, "Look again." The question isn't whether AI belongs in medicine. It's clearly, undeniably already there. The question is what we do with the very human discomfort of being in second place, of realizing that the thing that sees us most clearly doesn't see us at all. It just sees the data we leave behind. And maybe that's okay. Maybe that's more than okay. Maybe that's exactly the kind of help we never knew we needed. But here's the twist I promised you at the beginning, the thing that will actually stop you and think. Some of those 10,000 lives, the doctors who treated them, they never knew the AI had been involved. The alert came through, the diagnosis was fast, the surgery happened, the patient survived, and somewhere in a server room, a neural network quietly updated its weights and moved on to the next scan. No recognition, no gratitude, no awareness that it had just changed someone's entire future. And maybe that's the most human thing about it, that the most important thing it did without needing anyone to notice. So here's my question for you, and I really want you to answer this in the comments because I'm genuinely curious what you think. If an AI saved your life and you never found out, would you want to know? Does it change anything for you if the answer was a machine and not a human? Drop your answer below. I read every single one. And if this video made you think, if it got under your skin even a little bit, share it with someone. Because the conversation about AI and medicine is happening whether we're part of it or not. And honestly, I'd rather we be part of it. Subscribe to World Inventions X if you haven't already. Hit the bell, all of it. Because what we're building here is a community of people who want to understand the future before it arrives. And we're just getting started. See you in the next one.